So from petrissage, we go into friction, and friction again is just really getting into the muscle, or like the belly of the muscle. So if we ever have any kind of adhesions, which we're basically looking for when we're doing our effleurage strokes, is kind of feeling for knots or adhesions in the muscle. So when we're going through the back, if we find kind of any places where the muscle seems to be stuck or tight, or you kind of feel like, you know, something's not supposed to be there, or you can even ask the client, you know, does this hurt? Is this painful? You know, does it kind of feel like it's, you know, not normally supposed to be there? Does it refer pain anywhere? When you find a knot in the muscle, then what you can do is friction that area. And there's different types of friction that you can do. So you can use your fingertips when you find a knot in the muscle, and you can just kind of go back and forth over it. So there's cross fiber friction, there's with fiber friction. So if you know where the muscle is or what direction the muscle fibers run, like if you're working the rhomboids, all of those fibers tend to run like this. So cross body, or cross the back this way. So if we're doing any kind of friction this way, of course we're going cross fiber. If we're going to do friction this way, we're just going to go with fiber. So it's just kind of a nice back and forth motion to get that circulation moving. And you'll start to notice on the back that it starts to become a lot more red. And that's a good sign. That means we're bringing circulation up and through that tissue. Another way you can do it is without the fingertips, you could do it with the knuckles. So you can go back and forth with your knuckles if you wanted to. Or you can go back and forth this way. Or another way we can do it is if we wanted to do like both hands. And we're just going to kind of go back and forth with both of our hands, kind of holding on to each other. We can do longer strokes if we wanted to. We could do our thumbs if we want to get in there. So there's a lot of different ways you can do this. You could even do the edges of your hand like we did earlier, and then just kind of get in there and kind of do like a sawing motion with your hands, and this creates a lot of heat. So make sure that you have enough oil or lotion or cream on the body so that you're not kind of tearing through their skin and trying to rip it. That sounds really bad. You just want to create enough so that you can get that blood circulation in there and the muscle is warm. And you'll actually feel a difference if you feel on both sides, how one side's a lot hotter than the other. And that just lets you know that you're kind of moving that circulation and getting it up through the tissue like you want to. So good. She's starting to relax a lot more, which is good as well.